So, because we need to take time to review the data and to consult with our partners, including Public Health Ontario and health experts, and now we are confident we can now offer a second dose of AstraZeneca vaccine. So today, we're announcing that Ontario is moving forward with second dose administration of the AstraZeneca COVID-19 vaccine, beginning with those who received their first dose of vaccine between March the 10th and the 19th, 2021. The first group of individuals in the province who had received the AZ type of vaccine. I want to make sure nothing is more important than the health of Ontarians, and for the best protection against the COVID-19, it is vital that everyone who received the AstraZeneca vaccine for their first dose receives a second dose. Data from the United Kingdom at this time, because initially we had the data related to the much reduced risk of VITT, was initially 1 in 1 million, but they've updated their data as I had asked they would do. And we now say it is 1 in 600,000, still very, very low. But we did want to make sure we had the accurate data to give to the public. For a limited time now, during the week of May 24th, individuals who received their first dose of AstraZeneca vaccine during the period of March 10th to 19th, 2021, may opt for an earlier dose interval of 10 weeks with informed consent. That means that you understand the data and information, you can talk to your provider, and they can answer your questions. Choosing to receive the second dose of AstraZeneca vaccine at the 10-week interval is safe and provides strong protection against the COVID-19 infection. Individuals who are eligible and do not receive their second dose of AstraZeneca vaccine at the 10-week interval during the week of May 24th will be able to schedule their appointment for a second dose of AstraZeneca at the 12-week interval. Those who receive the first dose of vaccine between March 10th and 19th, 2021, can contact the pharmacy or primary care provider where they received their first dose to book an appointment beginning the week of the 24th. Individuals who do not receive their second dose at the 10-week interval during the week of May 24th will have the ability to receive a second dose of AstraZeneca vaccine within the recommended interval of 12 weeks. The province is also looking closely at available data and evidence from a clinical trial in the UK with early promising results of administering doses of 2 different vaccines. At this time, the National Advisory Committee on Immunization does not recommend that the vaccines of different types be used in the 2-dose series, as data on the immune response following the mixed vaccine schedules are not yet available. We look forward to receiving the NACI decision very soon. We'll continue to work with Health Canada to monitor the quality and efficacy of all COVID-19 vaccines being used in Ontario. The health and safety of Ontarians remains our top priority. All Ontarians are encouraged to get vaccinated as soon as they're eligible and to receive their second dose at the recommended interval to ensure maximum protection against COVID-19. It also remains critical that all Ontarians continue to follow all public health and workplace safety measures currently in place. I emphasize that because some people feel once you get a dose or second dose, you've reached the maximum capacity within a few hours. It takes weeks to build up that immunity. So you need to follow your public health measures in that time period. So by following these measures, we can further reduce transmission of the virus and safeguard hospital and public health capacity and save lives. So those are our main announcements today, and there was a fair amount of dates and times. So at this time, I'm going to ask our Alex to coordinate questions from the media for Dr. Huyer and myself. And so I'm going to ask Alex now to open up for questions from the media. So thank you.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
First question comes from Jessica Smith at Queen's Park Briefing. Please go ahead.
Hi, good morning. I really appreciate the update on AstraZeneca, and I'm sure my colleagues will have many questions. But my first question is for Dr. Huyer in his capacity as Chief Coroner. I'd like to ask you about some comments. I've been speaking with people who lost loved ones in long-term care during the pandemic, who believe that neglect caused or at least contributed to the deaths of their loved ones. They want some answers from the office about what it's doing to investigate deaths from neglect in long-term care. What can you tell them?
Yeah, thank you for that question, Jessica. And first and foremost, deepest condolences for those who lost their lives throughout the pandemic, but generally just terrible tragedy that you're talking about. Given my role with COVID-19, the Deputy Chief Coroner, Dr. Reuven Girard, with our office is fully charged with taking responsibility for all of that work. And so I don't have specific engagement in the detailed analysis or detailed investigation. So my apologies, I'm not able to provide any specific answers. It really is within others at our office, given my intersection with COVID in the provincial leadership.
Follow up?
Okay, to follow up, I'm hoping you can clear this up. Do coroners in this province have a legal duty under the Coroners Act to investigate these deaths, believing that having reason to believe that these people may have died from negligence? And do you know if the Deputy Chief Coroner is ensuring this is happening?
Yeah, again, Deputy Chief Coroner is responsible for this. I know that he's involved in evaluating and would apply all of the legal criteria that are within the Coroners Act and apply those to whether investigations are required. But the specific details, I apologize, I don't have those. He is completely charged with that work.
Next question.
Next question from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, doctors. Dr. Williams, just trying to get a little more detail, and I might have missed some of this because the sound quality on the call isn't the greatest today. How many doses are we talking about here? Is this the 45,000 doses that are left? Are these the doses that are expiring May 31st? And what about other people who got AstraZeneca after March 10th to 19th? What happens with them?
Yeah, well, thank you, Rob. And I'm going to ask Dr. Huyer to comment in a moment here. We are, because the message that we gave you, the information, I know there's some dates and numbers there that came fast and furious around timelines and that. And so there is a logistic time frame here where we are working on the AstraZeneca vaccines that we have currently that are due to expire in a certain period of time and how to utilize that, as well as some newer shipments we received and how we're going to want to move things forward on a go basis ahead. I'm going to ask Dr. Huyer maybe to comment on some of the details about that.
Yeah, good morning, Rob, and hopefully you can hear me okay. Apologize if there's a quality issue. So there's approximately 55,000 doses of AstraZeneca that many of which the effective date of the effective period of delivery is May 31st. And so we are focusing on those in this incremental approach to providing second doses in those who have received AstraZeneca at the first dose. So right now, the first focus is on those 55,000 and providing the opportunity for those who received their vaccine during the week of March 10th to, well, it's a little more than a week, but 9 days of March 10th to 19th, and providing that opportunity at this 10-week interval. As you know, the initial interval was 16 weeks, and what we're doing in our incremental approach that's science and data informed is we'll provide additional advice and recommendation for those who will be receiving their dose at the 12-week interval, which starts on June the 2nd. So we are working again during the week, next week, to continue to evaluate the data and the information that's available to provide the best current information and recommendation to those who are eligible to the second dose. They are first, front and foremost in our minds in ensuring that we provide the best opportunity to provide the best protection from AstraZeneca.
Follow up?
Thanks, Doc. So going forward, and can you just clarify for me? I didn't get that number when you answered. Could you tell me if it's 5,000 or 6,000? It's very fuzzy today, the connection. But so what is going to happen with people who? When will people who got AstraZeneca after those dates find out about second doses? And we keep hearing that the optimum period is 12 weeks. So how much less efficacy is there to get this shot after 10 weeks?
I'll start and then I'll pass over to Dr. Williams. It's 5-5, Rob, and I think it's your phone maybe, but just teasing you. But 5-5, and so 55,000, and then I'm going to pass over to Dr. Williams. But we are actively reviewing all information to make decisions and recommendations about the second dose, and there is time before that 12-week interval occurring for us to continue the work and provide further information to those who received after March 19th. And in fact, some that received during March 10th and 19th, because not everybody who received during that period of time will be covered by the 55,000. David?
Yeah, so the key thing here you're asking, Rob, is that on the clinical information, I'll try to speak as clearly as I can so you can hear me. So I hope, and your sound's a little bit vague too, so we're having technical issues, apologies. What we're talking about is that in the clinical trials, they had looked at intervals of looking at the vaccine efficacy following a dose. And they looked at various times, 4 to 8 weeks, 8 to 12 weeks, and different periods in there. And they noticed that at the 12-week period, they measured this going out 4 weeks after the dose of the different settings, till up to 16 weeks. And as we said before, the peak time when they said, if you wait until 12 weeks to get your second dose, these vector-borne vaccines continue to build up immunity, and they get a better response if you wait for a proper time period. The original 16-week period delay was based on the need of the overall, all the vaccines, including the mRNA vaccines, to allow to get as many first doses as soon as possible. Their peak time between first and second dose is still the original recommending time of 21 and 28. The difference about the vector-borne ones is that as you wait longer, it builds up more and more efficacy in that time. And even now they found that where in the past we said if you get 2 doses after 12 weeks, you might get up to 78 to 80% efficacy against symptoms. Now they've waited longer, and from the UK, the data indicates that may be closer to 85 to 90%. The difference between 10 to 12 weeks, they didn't measure specifically, but it's fairly negligible at this stage here. And so we think it's fine to use the 10 to 12 weeks. Many countries like UK were down to 8 weeks. But we're trying to get a combination of utilization of the timing and getting the maximum effect out there to deal with the cohorts and different groups we've got. We'd still like to go for that 12-week period if we can, to make sure people get the maximum peak effect from their vaccination. And it looks pretty promising if they wait out, and then over time they'll get up to almost equivalent to the mRNA vaccine as far as symptoms and infection protection. So that's really encouraging.
Next question.
Next question from Randy Rath at Sage TV. Please go ahead.
Yeah, hi, Dr. Williams. If I heard you correctly, you don't really know what the efficacy of AstraZeneca is after 10 weeks. And my question is, why would anyone subject themselves to getting a shot at 10 weeks when they know that there's going to be greater efficacy if they wait for 12 weeks?
Well, it's a good question, Randy. I think we know definitely if in the 4 to 8 weeks that it's at least 60% on that one there. When they did their study, they looked at a cohort group from basically 9 to 12 weeks. They didn't measure everyone down by 9 and 9.5 weeks, 10 weeks, and 10.5 weeks. So we know that the performance of that group overall was just about 70%. I'm sure the ones closer to 12 weeks was maybe about 75 to 80% because the range was 44.8 to 82.6%. So you know in that range there, as you get closer to 12 weeks, you're getting closer to that 80 in the upper level. So we have an idea of exactly what that is. That's only what the company supplied us with their cohort studies. So we have to work within that limitation. But we can feel confident that the overall performance was 69%. And I'm sure at the 12 weeks, it's closer to 82%, and 10 weeks, it's probably closer to 70, 75% in there. The UK, looking at their dosing and using what even less time, have seen results, as I said, as they wait longer and longer out past the second dose, it moves up to 80 to 85%. So I'm quite confident in those results and in the quality of that at the 10-week plus period.
And just to be a little bit granular, Randy, May 19th was the 10-week number for those who received their dose on March 12th. And so May 26th would be 11 weeks. And then you can do the math further from that as far as the calendar goes. So we are approaching the 11 to 12 week period of time as the vaccine would be given next week.
Follow up?
Yeah, okay. And has all of this, for lack of a better term, mess with AstraZeneca and the rollout, do you think it's contributed to vaccine hesitancy? Do you think that there's a segment of the people that have received their first shot of AstraZeneca that are just going to not go get another shot?
Well, I think that's a very relevant question. I do think the changing information material for some is confusing. I got more people saying, just hurry up and get it. I want it, regardless. And we're trying to meet that as soon as we can. One reason we wanted to allow for just the exact point you're raising, there may be some people say, well, in spite of the information material, could I wait and get a second dose with a mRNA vaccine such as Pfizer or with Moderna? And we said, and I said, I wanted to make that possible because allowing for that, if people want to take a decision to go with that, I'm looking to say, can I support that? And that's what we put in our introductory comments that thus far, the information is that a second dose with an mRNA vaccine is not hazardous. There's no real major complications. What we want to have is the data. How is the vaccine efficacy compare with the 2-dose of AstraZeneca with the mixing of the two? And as we said in our introductory comments, NACI has not stated it yet because they're carrying out a study at this time. Some studies in Spain have been positive. We need some more things in there to look at the vaccine efficacy. So we're sure it's safe to mix. They would wait for the 16 weeks. And by that time, we should have the results back and we should have some recommendations from NACI involved with mixing the vector style with the mRNA vaccine. And then what kind of vaccine result efficacy and immunological response will you get? Is it compatible? Is it equal? Is it better? I don't know. But we want to make sure the public have that for this group that you've actually alluded to, because we want to make sure they're informed as best as possible.
And Randy, I think it's a really important and a really valid question. And this is the challenge of ensuring that we have the best safety surveillance that we can in Ontario and in Canada and more generally. And then how do you disseminate and how do you evaluate and share that particular information? We saw a safety signal. We saw concerns. We wanted people to know. We wanted to make decisions that were the safest decisions possible. But in that messaging and in that sharing, clearly there are challenges with people having an understanding of how it affects the overall safety and efficacy of this vaccine. This is a very good vaccine that has provided tremendous impact in the UK and other countries. I mean, if we look across the seas and see how UK is doing, it's tremendously beneficial. And then we continue to look with a careful eye, working together with our colleagues at Public Health Ontario, the David Williams office, Public Health Agency of Canada, and internationally to really ensure that we have the best information. So I guess to some extent it's on David and myself to be able to provide this information in as effective a way as possible to help people to understand.
Next question.
Next question from Shalima Maharaj at Global News. Please go ahead.
Hi there. Thank you so much for taking my question. This one is both for Dr. Huyer as well as Dr. Williams. With the set number of vaccines set to expire by the end of this month, we have been hearing from doctors and also from people, obviously, who've received their first dose, who suggest that they feel like they've sort of been put into a guinea pig sort of experiment, that they, regret getting the vaccine, or from doctors who say they just can't get the vaccine out, that people are saying they don't want them because of all the bad press. So what do you say to reassure Ontarians who have sort of gone back and forth and receiving different kinds of messaging with respect to AstraZeneca? What do you say to them to restore faith and restore the confidence that they should be comfortable with going forward and getting that second dose?
Well, I'll start, David, and then you can follow. I mean, what I can say is we hear you. We completely hear you and completely understand how it's challenging. And what we want to do is ensure that people have the best information available, the best science, the best data, the best knowledge in a timely way to be able to make their decisions. So the information that we had when AstraZeneca was available was that this is a vaccine. We had a significant quantity of it. And I will say to those who got AstraZeneca, you contributed significantly to the population coverage of vaccine, which has had a broad effect on our population in Ontario to increase the percentage of vaccination and therefore decrease the burden of disease and continue to recognize how beneficial this vaccine was and is, and how with a second dose will provide even greater protection from illness, serious illness, hospitalization, and death. And we're basing that upon the data that we evaluate on a daily, sometimes hourly basis to be able to provide the best information to those to understand and make their decisions in a way that they will be most informed.
Yeah.
Oh, go ahead.
Oh, no, I would concur. I mean, that's the issue when you're doing a population-wide vaccination program. We're trying to give the public all the information we can. We want transparency and informed consent. That also, as Dr. Huyer's alluding to, at times does confuse some people. And they say, I'm not sure. What does this mean? Should I make the choice and not make the choice? And that's what informed consent means with all types of procedures. When you need to have questions, please consult with your primary care provider, consult with your pharmacist, because these numbers they sound like something, but they're very low risk in a lot of situations, especially compared to COVID in that. But at the same time, we want to make sure that they say, well, if you knew something, how come you didn't tell us? And that's what we said with our safety triggers and that. We're trying to be as open as we can. We moved on the overly cautious level. We were one of the first ones to pull back on the first dose of that. And we want to make sure that it is safe, continues to be safe and very efficacious, and certainly gives excellent protection against severity, as Dr. Huyer's alluded to. We've seen the benefits of that in the UK because we are still in the third wave. We are still having a lot of people in the 20s to 40s end up in ICU, and we're getting deaths still, unfortunately, occurring in that younger age group. So this is not to be taken lightly. The risks of getting COVID far exceeds any of the risks we're talking about with the AstraZeneca at this stage, especially the second dose in there. We've also changed in our supply matters. We have now a lot more supply in our other vaccines as well. So it's a changing venue, and some things are part of that is making sure the public are informed and aware of that. But I know it does then cause the public sometimes, and I can understand that, to be confused on the matter. And so we want to make sure all venues are open for them to ask all the questions they need to ask, because these are important decisions to make, and not making a decision is also not a good decision. And so you need to be informed, but don't delay, make a decision, because it can have hospitalization and life impacts.
Follow up?
And this final question is for Dr. Williams. This one is for my colleague with regards to education. We didn't hear anything about schools yesterday when we heard about that three-pronged reopening process. But given the increase in the number of people getting vaccinated, is it feasible to reopen schools for even just a few weeks? And, what kind of timeline do you have in mind here at this stage of time for that kind of reopening?
Well, thank you. And we have been all the time, I said, caught between two things. One is protection of the schools. We've had a good record up until we hit the peak of the third wave, and when we were overwhelmed with cases coming in, our public health staff out in the field, different health units said we're being overwhelmed. We cannot maintain the quality of case contact management as cases present to the schools. And so therefore, while there have not been any evidence of great extensive or any transmission in the schools, we can't guarantee that on a go-forward basis as our numbers skyrocketed and we went well up to over, some health units over 200 cases per 100,000 per week. And so now we've come back down again. But at the same time, Medical Officers of Health did so reluctantly and said, I really feel bad, but we're going to have to close the schools because I can't guarantee the ongoing safety. I think children should be in school. They felt that way. They should be back as the first to go back, the last to close. And so as we go on this forward basis, as our numbers are coming down, 1,898 today, well, we're still just have a bit down the peak of the second wave. So we've got a way to go. So we're coming down rapidly. And so we would like to look at a team approach overall. We would like to recommend that when our health units are ready, and they say, none of the MOHs across the board said, we really strongly support for the health and mental health and development of children, they should be back in school. At the same time, we know this means negotiating and discussing with the Ministry of Education, with the boards of education. There's different teams with staff and teams, people getting vaccinated. Our special ed, spec ed teachers have already been vaccinated, a large number. The percent, I don't know across the board, every location, that's board by board, and teachers as well. So we're ramping up again to make sure all our testing things are in place. So I still think it'll be valued to be back. The exact time of that, as I said, it's always been a coordinated approach and looking for that to happen as soon as possible. They have my support for that, and pretty well nearly all our medical officer health is saying, we think we're ready to do case contact management, we can handle that. So we're working with our partners in education, as well as the local boards and staff to make sure this gets up and running. And of course, make sure the parents feel, are they confident? And we want to make sure the parents are informed and ready to do that. So we want what's best for the children. And we think in school is one of the best things they can do, and to do what we can for the rest of the school year.
Next question.
Next question from Jeff Gray at the Globe and Mail. Please go ahead.
Oh, hi, thanks. Hi, doctors. I wanted to ask about that, the data on the safety of the second dose, because we originally had this 1 in 1 million figure, and that's now down to 1 in 600,000, I assume, as more cases have emerged. That's what happened with the first doses. How confident are you that that number isn't going to continue to decline as we get more and more data from people who've gotten the second dose and ended up with a blood clot?
Well, thank you. And that was the reason, if you recall, when I said, people asked me right away, what about the second dose? And I said, I'd like to be informed as the updated data on those issues there. The last I had was 1 in 1 million in there, and I want to look at different studies. This data just came out from the UK with some further review. It may seem it's a significant change. It went from a few up to 15 cases out of their whole cohort, and they did a mass amount of vaccination in there, but some of these things take a time to see. So we moved from 1 in 1 million down to 1 in 600,000. That's still a very rare event. We will watch, we'll get informed with more data and information. And as we did before, if there was some reason for concern, we would move on that. But that's with all our different experts, including those in Public Health Ontario, the federal level, Health Canada, et cetera, and on the global perspective, as we see this massive vaccine program being undertaken. I think what's reassuring to me is the adeptness and quality of the safety monitoring, very closely looking at all these ones. And that's the thing, it's probing and looking for any type of triggers and safety concerns at all, and moving on those very adroitly and quickly to ensure the safety and the ongoing quality of the vaccine program. So I'm confident right now in the safety and those numbers, but we will continue to be informed by experts, and we want to be watching for that all the time and be updating accordingly. And the public will be the first to know when we have the data that needs any significant change.
Follow up?
And I want to know just what happens if people, if you don't get people coming forward to take these doses that expire May 31st? Is there a backup plan, or what happens if people just don't want them and they want to wait for Pfizer or want to try a different approach?
So I think if you're asking about the ones that are due to expire the end of May, is that what you're alluding to in particular?
Yeah, I guess that's the issue, I think. Yeah.
Okay, I'll let Dr. Huyer make some comments on that, because we're dealing with a fair size cohort that has the opportunity to choose on that. So maybe he may want to talk about some of those logistic issues.
Yeah, thanks for that question. We have been receiving a significant amount of reach out asking for this potential for this opportunity. So we will monitor it on a very tight basis, and then we'll make decisions about other approaches that may be required. If we think about this, it's 10 weeks as of last Wednesday, and those who are March 19th recipients would be 10 weeks as of next Wednesday. So there is considerations, but we have seen and heard significant this is a request for this opportunity, and we're providing all best efforts in a very reach out way to let people know this news release, but also there will be conversations held at the local level where the vaccines were provided to be able to provide the opportunity to reach out to those who had received the dose as well, to notify them of the opportunity.
Next question.
Next question from Faiza Amin at City News. Please go ahead.
Hi. I'm not sure if you answered this question, but I'm just curious, for people who received their first dose of the AstraZeneca vaccine after that March 10th to 19th date, will there be enough supply for everyone who does want a second dose, or will some people have to depend on the mixing with the trial going underway?
So I'll start and then Dr. Huyer comment. We are, as we go for when we use up the stock that's due to expire at the end of May, we have another order already in our warehouses of 250,000 of the AstraZeneca, a bit more than that, 254,000. And we have promises of some more coming, but we don't have it definitely committed yet. So we need about another 750,000 doses basically to cover that, less than that. So we feel confident we can get some more. And we're doing all we can with our federal counterparts who are the procurers of it to see if we can obtain some more of that vaccine stock. There may be some redistribution from some other provinces. We'll have to see on that. So we have that option. The second one, as we've alluded to, if there isn't, we certainly have lots of volume of our mRNA vaccines. And we're waiting for, as we said earlier on, you might have missed it, we're looking at having NACI and other groups carrying out studies to look at, we know the safety's okay. We want to say, so what is the immunological response to mixing a vector-borne vaccine with an mRNA? And so we want to make sure we have that data in hand if we're going to go that direction so that the public are fully informed on that matter. I'm not sure, Dr. Huyer, if you have any other comments to make in response to that question.
Yeah, I think this again speaks to the day-to-day challenges that Dr. Williams and many in the province struggle with as far as a pandemic goes. We're having to make decisions quickly. We're making decisions based upon the data and the information that's available to us. And right now, we're making a decision and a notification about what to do for this week's supply. And as more supply continues to come, then we will continue to inform the public and inform those who received their earlier doses with a goal to provide, with a plan to provide second doses to everybody who received their AstraZeneca in the most informed and data-driven way.
Follow-up?
Thank you. And, I know there was a pause on the AstraZeneca, and we're speaking here about second doses. I just saw somebody asking that they're still on a wait list to get their first dose of the AstraZeneca. What's the advice for someone who does want a first dose, or is the province not providing first doses at this time?
So we've still had the pause on the first dose because we see the rate of the adverse event, the VITT, has remained down in the 1 in 60,000, perhaps going a bit lower as we are still working for some newly reported cases since we have paused the first dose. In that, fortunately, we have a good diagnostic process, and thus far, a lot of cases have been handled with success. That means we still have to be cautious on that. The other factor that has changed is that our supply of the mRNA vaccine has greatly escalated. And as you can see, we're dropping down with more and more availability across the board of that. Now, what you're asking me is if say someone says, well, if I had my choice besides the mRNA vaccine, I would still like to have the AstraZeneca vaccine, or maybe in the future, the Johnson & Johnson or Janssen vaccine. We haven't moved on that yet. That may be something they could discuss with their primary care doctor, who they may say, I have some reasons why, in spite of the fact it's 1 in 60,000, 150,000, I'd like to talk to my primary care doctor because I'd like to get it anyways. And that's something we'd have to entertain because that's fully within the proviso of a physician. If they feel with the risk assessment that to discuss with their client and patient, they can make that kind of recommendation. I haven't opened that up yet because we have one reason to have a good for pause. We're trying to get enough vaccine to get the second dose done of the AstraZeneca, so we have a supply issue. We haven't got the supply problem with the mRNA vaccine, and its performance is excellent as well. So we still say at the time you haven't received any vaccine, when your turn comes up, the one that's available, which at the moment is the mRNA, the Pfizer, go for it and get that. But if you have concerns and issues, discuss that with your primary care physician and how you might want to acquire that when that time arises. But right now we're trying to get enough AstraZeneca to get those who had the first dose to get the second dose in a timely fashion, and we're working our best to get that.
I will give a concrete example, though, where we are based upon solid clinical advice and caution. If somebody has a potential allergy to the Pfizer or Moderna products, then we have a process in Ontario that there will be a link with an allergist, and we have a supply for first doses for those to be provided. Again, under careful, thoughtful clinical guidance, and also recognizing the potential side effects, but the side effects or the risk of an adverse event compared to the risk of an allergic response, and then weighing into how dangerous COVID will be. All of those factors are considered, but we do have clinical indications in small numbers, but we are absolutely providing that opportunity for AstraZeneca because it is a good vaccine that has provided great protection for many, both at the single dose level, but then even more so with the second dose.
Last question.
Last question from Lorenda Redekop at CBC. Please go ahead.
Hi there. Could you clarify? It looks like March 10th to 19th was part of the pilot project. So is this limited time offer just for people who are from those three regions? What was it? Toronto, Kingston, and there was one more.
Yeah, I'm happy to answer that, Lorenda. Nice to hear from you. Absolutely. Well, those are the only people, I'll be simple about it. Those are the only people that have received the vaccine. Those are the places between March 10th and 19th that they received it. It was in Frontenac, Kingston, Frontenac, Lennox, and Addington, number 1, number 2, Windsor, Essex, number 3, Toronto, and then the primary care practices, there were 6 public health units, Toronto, Hamilton, Wellington, Dufferin, Guelph, Peterborough, Simcoe, Muskoka, and Peel, and they were the areas where in the province this vaccine was provided during that March 10th to 19th period. So it's really about where it was given and the time. It was really about the time frame it was given, and those are the areas that were the initial ones. Thanks for raising that. It's really a great way to help people to understand where the reach out may occur or where they can reach out.
Follow up, and this is the last question.
I know a lot of people who got other vaccines are really wondering if the second dose might be sped up from the 16-week period. Given how much supply is coming in, is there anything you can say to people who may be wondering that?
I can say this is another conversation that occurs every hour, every minute of every hour, trying to think through how are we going to approach this, looking at ensuring that we provide the first doses to complete as far and as broad as we can, and then where do when we have the first doses getting to a level, where do the second doses come in, and is there clinical reasons specifically to move somebody up earlier? Those are all conversations that are happening regularly to be able to plan and to make the best decisions based upon the supply and also the risk that people may be under, although the first dose provides substantial protection from serious illness, hospitalization, and death, and significant protection from infections.
Yeah, and I would add that to the credit of Dr. Huyer and others in the task force, this balance and the work involved in the logistics and carrying out this massive vaccination program with the supply and variable things has been a huge endeavor and gone on really well. We've with the COVAX system, the logging, and all the volunteers and people in different areas, and they're going to do it as effectively and efficiently as they can because we want to get as many first doses in as soon as we can, and then move on to second doses as soon as we can. High priority groups. There's just a large area, and I think which is really I think exciting and positive is the amount of demand that the public or Ontarians want. and we're going to try and match that as best we can to get that as quickly and in a timely way throughout the province of Ontario. A big geography, high-risk zone areas, workplaces, community hubs. There's just so many things going on. So it's just a fantastic program as we head up beyond 7, heading to 8 million doses. I know, Dirk, what's our last stats? We're getting close to that 60% on first dose. So it's a terrific endeavor.
It is so amazingly exciting. I'm just going to have to lean close to the camera to read it. Yeah, last night we weren't quite at 60%, but pretty darn close. And it's just, you know, if there's any problem to have, it's a problem of people wanting something and coming out and wanting to succeed. And my tremendous acknowledgement to everybody in this province who has been working so hard to try to keep this vaccine, this virus down, and taking all of the steps to get vaccinated, taking steps to prevent transmission, protect the public, and really enhance the health and safety of Ontarians. And then every healthcare worker, everybody in the public health units, everybody that's been responding to all of this. And I know I've left people out, but just unbelievably hardworking day in, day out, and everybody who's had to do all of this tremendous work of abiding by stay-at-home orders, etc. So yeah, no, it's a very exciting time that we continue to push forward as aggressively as we can.
Thanks, everyone.
Thank you.